The health care debate is hot on Capitol Hill. Some want a decision right now, and some want to wait. And Northwest Ohio's delegation is weighing in right now. Here's Sean Hegarty with tonight's Talk Back.
Joined now by Congressman Bob Latta from Washington. Congressman, let me ask you first about this health care bill. There are some on the Hill that are asking for a delay and not hit this end of July deadline. Would you like to see it talked about now, or would you like to wait until Congress goes on their break in August?
I'm absolutely one that thinks that we got to slow this process down, because this bill originally started at around $634 billion in costs. It's over $1 trillion now. Last week we had the Congressional Budget Office tell us that the plan that's being proposed by the President and the Democrats here could actually now cost us more money than what we already have. And the whole idea of this, we want to control costs and give people that access that they need for care. And to try to rush a bill out, and who knows what we could do to the American healthcare system in about 2 weeks period of time, I think we've got to slow this process down, because it's way too important. And the big reason for this, trying to get this done so quickly, is the President knows, and Speaker Pelosi knows, that when members go home during the work period in August, they're going to be out with their constituents, and they're going to be really quizzed by them. And the people back home want to make sure that, they can keep what they've got, and that we don't have a system out there that rations health care, and we don't want to see that happen. So I think it's absolutely vital that we slow this process down.
So if you were to make changes to the healthcare system that we have right now, what kind of things would you like to see done?
Well, you always talk about the waste, fraud, and abuse. I just talked to someone this morning when I was coming back to Washington that, they pointed out different areas where they need to go into and say, you can save money there. You want to make sure that, people out there always have the ability right off the bat to say that they can keep what they've got right now. If you like the insurance that you have, you ought to be able to keep it. We also want people to have be able to have that choice, to be able to control costs. And that's really what it comes down to. And, we want to make sure that all happens. But if you try to rush this thing through in such a short period of time like they're trying to do right now, we're going to end up what we saw on the cap and tax or cap and trade legislation, where things are rolled out the night before at 3 o'clock in the morning. They bring it to the floor and they say, here it is. And we can't do this. This is too essential to make sure that Americans have the best health care system in the world.
Do you think there's any way, shape, or form that a government option would be viable?
I don't think so. I'm absolutely against it. And, all you have to do is look around. What does the federal government run that runs well? And when the federal government touches things, it pretty much collapses. And I think that this whole notion of saying that we're going to put a public option out there, what will happen is this. The public option will become one where pretty soon the federal government will be making it harder and harder for the private insurance to exist. And they always say, we've got the full faith and credit of the American taxpayer behind us. And so, they could do things that, early on that would just make these things explode. Anything that we've done, you go back over the last 40 years and costs. You've watched these projections of what it was going to cost per year have escalated up and up and up. And, again, the American taxpayers just can't foot this bill.
All right, we will see how the vote comes down, if one comes down, in the next couple of weeks. Congressman Bob Latta, thank you very much for your time, and that is tonight's Talk Back.